Hello. Hi, welcome again. I am Dr. Erica Onigbola, pharmacist for close to 10 years now, and I appreciate you joining me on this live chat. I am a registered pharmacist, and I'm coming to you today to speak about the menstrual cycle and oral contraceptives. Just briefly, um, just to let our female viewers understand and know that the female cycle, which is conception, birthing, um, also a way of the body to rid of waste, and also uh, to help regulate uh, the the proactive cycle. So, with that being said, I want to start off by just going over the menstrual cycle and the different phases. There are a few different phases that involves the hormones and the pituitary gland, which is located in the brain, and then there's also um, the luteal phase, which helps to maintain the unfertilized egg during the cycle. And then there's also um, the the phase where the menstrual cycle itself, which includes the flow. And with that being said, I just want to make mention that the beginning of the count during of the cycle begins at day one of the actual flow, which lasts for about 5 to 6 days, and that will be day 5 or 6. And then at day 14, the follicular phase is where the egg is being matured and being prepared for release for conception, and that is at day 14 of the cycle. And then after about day 14 to about day 28, that that egg, that luteal phase begins and continues on until about day 28. And at day 28, which becomes the next day, day one, is where the flow actually begins. And that's where we see the menstrual cycle phase. There are oral contraceptives that are available. There are over-the-counter medications to help prevent infections in the feminine hygiene uh, area of the pharmacy. And then there are medications that come out of the prescription department, the pharmacy department, that will help with the regulation of the menstrual cycle, and uh, those are combined estrogen and progesterone medications, or they just might be progesterone medications only, depending on the age and the um, the age of the female, and also the her medical history. So depending on whether there's an intact uterus, whether there are ovaries that are still intact. So the prescription, upon evaluation, physical evaluation, will determine the content of the oral contraceptive. So I just want to today let our female patients know about the different phases of the cycle, and also the combination of oral contraceptives. Oral contraceptives are not just for procreation or uh, the prevention of, but also for the regulation of the menstrual cycle, so that the in case there is an opportunity for fertilization, the menstrual cycle will be regulated properly, and then therefore conception can occur. So, if there's any questions or comments, please let me know. I just wanted to give that bit of information. And also, the the prescriber will definitely not only do a physical evaluation, but also based upon age, uh, write an order for a medication or a contraceptive medication that is specific for prevention of side effects that comes with the consumption of estrogen products, uh, like um, blood clotting and tenderness of breast tissue, things like that. Those side effects can be prevented in certain age groups based with the lowering of the milligram of the active ingredient estrogen. So keep that in mind as well when you're picking up oral contraceptives and being prescribed those items, that they are being prescribed safely. Okay, thank you for joining me today. I'm glad that you were able to join me, and I look forward to bringing back more information on this topic, and leave any comments or questions you may have in the comment section. I'll be happy to get back with you. And if you have any thoughts about what you would like to hear from my content, let me know, and I can do a video on those as well. Thank you for joining me. Thank you. Bye-bye.